Manyando Mlonda. I am the head of department here at Munari Girls Secondary School, special unit. My role here is basically to coordinate the teaching and learning for our learners with special education needs. As you are aware, COVID has been with us for close to 2 years now, and from the time COVID started, we have been sensitizing these learners. And because of that, they have become aware of all those code and rules that are required for them to keep safe from COVID-19.
I'm a visually impaired teacher, short-sighted. I offer civic education and RE. On top of that, I also do Braille. I handle pupils with visual impairments. So it has been a big challenge for these children to know most of the guidelines. Remember, these children, they depend on hearing. They can't see anything. So most of the activities concerning COVID-19, they are advertised on the TV, and the children cannot see them. And then also, this child is always with the guide. So we are seeing some challenges. This child is able to touch at any place. Because for her or for him to move to allocate where the class is, he or she is supposed to touch here and there. But we are saying touching here and there is something which is bad for to get this COVID. So for these children who are not able to see, they don't care.
We have had quite a number of challenges when it comes to the classroom section. To begin with, the classes are very, very small. And then the number of pupils are quite many. So keeping social distance has been a challenge. You'll find that where pupils are supposed to sit one on each desk, you find that there are two, and the desks are not big enough. So social distance is quite impossible to be observed. And then when it comes to wearing masks, they do wear as long as the teacher is there, but the minute you leave, they remove them.
Basically, our learners, those that are deaf, they depend on sign language for us to interface and communicate with them. And the sign language, unlike spoken language, it's a visual language. And one of the guidelines to prevent COVID-19 is the wearing of masks. And as you sign, you're supposed to talk at the same time. But when you're wearing the masks, you are preventing the learners from, reading the speech. They can't read the movement of the lips. My appeal would be that maybe our learners and the teachers who are handling these particular learners, if they can be prioritized in terms of vaccinations, I would love the powers that be to consider our school, to consider our teachers, to consider our learners. Also, even the issue of the PPEs, we need a lot of them. These learners, they keep on losing some they misplace, others they get damaged. So it is not just a one-off thing to say if you receive a donation, then that's it. It should be an ongoing process. So definitely I'd love to meet and speak and appeal to those people that are in policy-making positions. So
these children are able to do a lot. It's just that sometimes we have got a negative view. What is important is let's help them. Whatever we have, it's important to help them.